Hey everyone, welcome back to Politics and Media 101. I'm Jeff Browning, and if you listened to our first few episodes, then you know that over the last few months, my friend Justin Higgins and I and our friends have convened hundreds of conversations, sometimes more than once per day, with over 250,000 live listeners and participants, where we all hear live and direct from people in the news, in their own voices, in their own words, in long form, and where anyone who wants to can join to ask them a question, share their thoughts, or just listen. We're just now starting to release recorded portions of our live conversations for the first time, and we're grateful to you for joining us. Today, we're very excited to release part of a conversation, interview, and audience Q&A we had with Congresswoman Brenda Lawrence from Michigan. She represents part of Detroit, the city of Southfield, and 16 other cities in Oakland and Wayne counties. She was originally elected mayor of Southfield in 2001, the first African American and the first woman ever to serve in that position after serving on the city's school board. She's now a member of the House Appropriations Committee, where she plays an especially close role overseeing government spending on education and healthcare. One of the issues we talked about was the census. Every 10 years, the U.S. takes account of how many people live in each part of the country. Those numbers are used to determine how many seats each area gets in Congress and also how much each area gets in federal funding support. We talked about some practical challenges with the most recent census and what impact it could have. We also talked about the post office, about why some parts of the public are still hesitant to take the coronavirus vaccine, what she and other members of Congress are doing about it, and about structural inequalities in the healthcare system that face women, especially women of color, and why some women in the United States face astonishingly high maternal mortality rates. It was a great conversation with fantastic audience questions, and we hope you enjoy it. As always, if you like or dislike what you hear, if you want to find out how to join us live almost every day of the week, maybe ask one of our upcoming guests a question, or hear past episodes, please visit our website, pm101.live or pm101.club. They both work and will get you to the same place where you can find all that and more. Without any further ado, let's roll the tape.
You've had a busy week so far with the debt vote. Is there anything you're looking forward to end the week? Maybe getting back in the district and a get-together, or anything fun that you're kind of looking forward to getting in?
Well, I don't have a lot of fun these days. I just work. Things are so serious and there's so many challenges. But one of the things that today I've done a couple of town halls with women, and it's just so exciting to have the conversation about a once in a lifetime opportunity to invest in families and to invest in women. And we keep telling people that if you don't support this Build Back Better, then are you not supporting women? And I will tell you that you're not. So it's exciting to have this opportunity, but it is tremendous amount of work. And that's the part I look forward to. And when people hear about all the things that are in this bill, then they go like, oh yeah, that makes sense, The child care piece, so many people have ignored it for years. Do you realize that nearly 40% of child care workers are Black and Latina, and 17% are immigrants? But the median wage for women who care for child care, the workers, it falls behind and below a living wage. So that leaves around 1 in 6 women living below poverty. And so those are the things that excite me. Like, it's like shaking people awake. We say our children and our elders, they mean so much. I would do anything for my parents. Like, I will walk through fire for my children. But you insult the people who are caring for them every day by, as a country, we allow them to make some of the lowest wages in America. And they're predominantly women. So when we talk about child care and raising their salaries, this is about investing in women.
I just wanted to get your thoughts on the issue that the Postal Service is implementing cost-saving measures that will result in delays. You're dedicated to the Postal Service, and for many people that may not know, you have a long history working with the Postal Service, and you're a big legislator, maybe the most prominent legislator on this issue. Can we get your response to today's news and just the impacts that it's going to have across America? Will it impact underserved communities that get medicine through the mail? And if so, what should we do?
First, I want to correct the statement that reducing the service standards is not going to save money for the Postal Service. The post office, and for those of you who don't know, I had a 30-year career there, and I'm the only member of Congress who had a career in the Postal Service. So with that being said, the Postal Service is the only federal agency, or only business period, that touch every single household 6 days a week. It has the largest fleet in the United States and the second largest employer. So when you talk about the Postal Service, which is mandated by the Constitution, and which, by the way, have the highest approval rating of any other federal agency, and we are talking about reducing the service standards. So, like you said, there's a lot of people who get their medication by mail. There's a lot of people who, some of our seniors still want their checks delivered to them to their home. We have so many things that are essential to our day-to-day life that comes in the mail. And here you are, you're telling me in the state of Michigan, if I live in the east side of the state and I'm mailing a letter to the west side of the state, which I can drive to in a matter of 4 hours, why would you tell me now it takes 3 to 5 days? Where does that save money? We had a postmaster general who came in the middle of a pandemic. He never experienced the dedication, the hard work, and the overall performance of a fully staffed, regular day-to-day postal service. In addition to that, he came in right in the middle before we had an election, where the Postal Service was weaponized as a political pawn and in this whole vote by mail situation. And he made some steps to really shorten and interfere with the ability of the Postal Service to deliver the mail, that we had to make him stop, where he was taking out collection boxes. He was taking machinery out in the middle of an election. So his answer to COVID, to the health crisis that we have had a major impact on staffing, is it's just like your child fails a math test. So you tell the teacher, just change all of the questions to ones he can answer, and therefore he'll have an A. No, he will not get the training that he or she needs to be proficient in math. And right now, I speak as a 30-year employee. I was a supervisor of the letter carriers. I worked in HR. I had numerous positions. And I know the pride and the hard work that postal employees put into making those service standards. If a truck breaks down, which is not the norm, but they will break down, and you miss a service standard, it is this overall, we didn't make our standards. I was a supervisor letter carrier. Every single day, every piece of mail had to go out that door. It was not acceptable to leave a piece of mail on the floor. And we took pride in that. Managers and supervisors were rewarded if we made our goals. If an office made a goal, the employees, they benefited from that. But now you're dumbing down our goals and our standards of the Postal Service. And for me, that's unacceptable. Be a leader and fix what's wrong. Know that we're building the staffing back up from COVID, where most people didn't recognize that postal workers are first responders and they never stopped working during the pandemic. So there were outbreaks, there were deaths, there were people who had loved ones at home and was afraid to come and work in that factory-like environment of delivering the mail. And then think about carriers who literally went to door during COVID where everyone was at home. So I'm just really disappointed with the leadership of our Postmaster General.
Yeah, thank you for that. It's wild that he is still the Postmaster General. But I did want to switch gears a little bit to another thing from today. You were actually quoted in the Washington Post about a potential undercount in the census. For everybody in the audience, real quick, the census is not only used to determine our congressional districts and the size of different states, but also the allocation of federal funds. So it's a very, very important counting of citizens. Can you tell us what your concerns about the census process under this last administration were and get into the issue that was highlighted in the Post?
So I will be very clear. I sit on appropriations. So that's the committee that allocates funds to all of our tax dollars, federal tax dollars, come through appropriations, and we allocate those funds based on a formula. And that formula is set by the census. So let me give you an example. The roads in underserved communities that were undercounted will not get the federal dollars to fix those roads. The funding for schools, for funding for housing, all of these things, it goes through that magic formula. How many people live there? What are their incomes? How many children are there in a particular area? And there is this huge undercount. And the crime in this is that there's a lot of people. I grew up in a Black family who used to say, don't open the door. The old people would say, don't open the door. They're trying to get in your business. You know, they're going to ask questions. And, you know, they said if somebody has a warrant, they'll take them to jail. If someone owes back alimony, they're going to, you know, all kind of just untruths. But it was this real fear of opening your door to census workers. Well, now you add to that the digital divide. And so now they're saying, go to your phone and fill out the census application. And if you don't do that, then we'll knock on the door. Guess what happened? COVID. Guess what happened? Donald Trump stopped the count early. He didn't even go the whole mandated time. He stopped it. And so all these things, did we undercount? Absolutely. And I know in Detroit and in some of my poor communities, the count was much lower than what we anticipate is the reality of the people who live in those communities.
Thank you for that. Another issue that kind of piggybacks off of COVID, but we see structural inequalities throughout, is with the initial rollout with vaccines. And I kind of want to dig into a really amazing initiative that you worked on. You organized a project to address vaccine hesitancy with other members of the CVC. We have Congressman Jim Clyburn coming on tomorrow morning on this show. But I want to get something that the public doesn't see. Congresswoman Lawrence, can you take us behind the scenes of how this initiative was developed? And just as importantly, how did you folks develop a message that would resonate with people that you felt might be vaccine hesitant?
So as you know, we just came off a campaign where we had Get Out the Vote. And we went all over the country, the Black Caucus, promoting and encouraging people and messaging to get out and vote and how important it was to the life of the Black community. So I am in the leadership of the Black Caucus. I'm the second vice chair. So I went to the chair and said, we as the Black Caucus, we recognize that the Black community is one of the highest in vaccine hesitancy, and that our people disproportionately dying at a higher rate. And so we as a Black Caucus need to develop a strategy. And we talked about it. And I recommended, why don't we do Get Out the Vaccine? And I can tell you it was exhilarating just going from churches to community centers to schools, talking to groups of African American and young people to talk about the need for the vaccine. And the thing that resonated the most, Justin, was do it for your mother. Do it for, your children. Don't you want to be around to see them? You may not want to. You may say, I don't care about that mess. Or, there were so many messages that were just false, like people were dying from it. They were implanting a chip in the arm of all the Black people to track them. And I remember talking to some young African Americans. I said, hey, do all of you have a cell phone? I said, bring it out. And they took it out their pockets. I said, you're being tracked everywhere you go from your cell phone. Every time you being off one of these towers, they know exactly where you are. They don't need to put a chip in your arm. It was so many things that came up. And then I said, name me one person that you know that died from the vaccine. And they kind of like, I don't know. So name me a person you know who died from the virus. And it was just slapping the truth and reality in their face. And I'm a Black woman. I said, I got the shot. I'm still standing. I did not pass away. I want to live. And then I want my family to live. I don't want to contaminate my husband, and I want my granddaughter, and my sister was sickly, and I didn't want to contaminate. I said, do it. If you don't want to do it for yourself, do it for your family. And that really resonated.
I love that, because so much of today in politics and everything else is what messages resonate and how did they ultimately get created. So I just imagine a bunch of the CVC leaders, you leading them in a brainstorming session and being like, hey, we got to pull up our boots and go do this. So that's kind of cool. So thank you for that. I want to switch into another aspect of structural inequalities and get your thoughts on what we saw from COVID. So these structural inequalities, specifically facing women and women of color, have always existed in our society. But for many, looking at COVID-19, it became real. There are statistics that you can look at with employment figures and how women and women of color were greatly affected more than any other demographics. The wage disparity has increased. Could you go into how COVID-19 has highlighted and maybe exacerbated some of the structural inequalities facing women and women of color?
Yes, I can. I am one of the chairs of the Women's Caucus for Congress. And what I tell a lot of people, what the pandemic did, it ripped the scab off of a just sore that we have in America. And that's the earning equality for women in America. We celebrate, like in July, the Equal Pay Day, where women make as much money as men. So the facts are women of color experience a wage gap. For every dollar paid to a white man, a Black woman makes 63 cents, Hispanic and Latina women make 55 cents, and Native American and women make 60 cents and Asian women make 90 cents. So when you talk about the pandemic, who are the majority of our first responders? When you went to the grocery store, the majority of the grocery store cashiers are women. The hospitals, your nurses, your senior citizen facility, predominantly women. When you look at all of these jobs that were held by women, and you look, it's already a disparity in the pay checks that women get. But we know since the pandemic, we've lost more than 2 million jobs. And what matters is that the labor force participation for women, it contributes to more than $7 trillion of our U.S. GDP. And so we have seen the number of women in the workplace drop at a higher rate than the men. And so we keep using this term build back better. And Nancy Pelosi and I have taken up the term, let's build back better with women. Let's make sure that when we are creating these jobs and when we're moving the economy, that women are not going to be left behind. One of the complaints of the transportation bill that would invest in our infrastructure is that 90% of the jobs that they're talking about, 90% of those are currently occupied by men. So if we're going to increase the skilled trades, if we're going to increase the truck drivers and all these different jobs, then we have to be deliberate in making sure that we're building back with women.
I honestly don't know if I should say this on air, but I did not know that. And that makes sense about the infrastructure bill and the jobs that are being created. So thank you for that. I want to get into a little bit more specifics, though, of the Build Back Better bill, because you look at polls, right, Congresswoman, you've seen them. There was one that said, I think, only 10% of Americans understand what's in the legislation, or at least say they understand. And then there was another CNN poll today which said only 25% of Democratic voters think that the infrastructure and BBB bill will make their lives better. And that's Democrat voters. So help us understand what is in this bill, and specifically, what is in this bill that is going to address some of the structural inequalities for women and women of color that you just.
Number one, and the one that I keep screaming from the rooftops, childcare. So when you talk about childcare, do you know half of the working families report having difficulty finding suitable childcare, citing the cost, the availability, and the quality, and that the United States loses $57 billion every year in economic productivity and revenue due to childcare. So I'm saying this and talking about women, but we have so many places, 51% of American families live in a childcare desert. Now, the reason why I'm talking about this in relationship to women, but I had a town hall on childcare on specifically this issue, and one of the men chimed in. He said, Congresswoman, I pay more for childcare than I do for my mortgage of my home. And so when we talk about including in the bill that we will have child care based on no one should pay more than 7% of their income for child care. That's transformational, not only for women, but for families. And we know that the child care and elder care industry, they are, like I said before, they are the lowest paid workers overall that we have in America. So in this bill is that it will increase the wages of caregiving and pull them into the real labor market. So the trade-off would be especially for women of color who bear the brunt of caregiving, and 3 and 5 Black and Latino families, it will allow them to ensure that $26,000 per person per year to provide home care services, as opposed to $90,000 per year in other settings. But what we're saying is that we want to, in this bill, raise the wages of the caregivers. We want to ensure that we are giving the incentive for childcare for 7% of all families. You can, that would be the most that you would pay. And then we also want to look at prescription drugs, reducing the cost of that, where we would allow the negotiation for rates for prescription drugs, so that we can ensure. Those are 3 things that and early childhood education. We know that the United States at one point in our history decided, based on fact, that if we wanted to be competitive on a global level, we had to have an educated workforce. And we decided K through 12 that every child in America would get the basic tools to be able to be competitive, to go to a higher level of education, but be able to function. And we have an expectation here in the United States that if you're an adult, you can read, you can count, that you have some analytical skills that have been taught to you K through 12. Well, one of the other things we found out is that the basic fundamentals of learning happens in that preschool. And if you give every child, in addition to K through 12, this mandatory preschool where a child would be given all of the mechanics of learning, that they will be able to overcome social barriers that a lot of children in poverty have. They'll be able to overcome other barriers in their life to be competitive with people who have more resources. So those are the things that I'm very excited about, and things that I'm really fighting for.
We are going to move into an issue that is perplexing for somebody on the outside, Congresswoman. But for the audience, this is an undeniable fact. Black women are the core, the backbone of the Democratic coalition, having enormous and decisive impacts on key elections. Folks, we can look at Georgia, we can look at Alabama, we can look at Michigan, Wisconsin, but this isn't reflected in leadership ranks in the party. I think you lost a leadership race by only 1 vote. What can and should the Democratic caucus do to fix this outrageous?
So one of my beliefs of being a human being is that you can't fix something if you don't recognize that there's a problem. There's no initiative, there's no desire, and ignorance is bliss, right? So I made a deliberate message to the caucus that the last woman who served in leadership, that means where the caucus comes together and elect a leadership position, was with Shirley Chisholm over 44 years ago. Think about that. We, as a Democratic caucus, had not elected a Black woman. Although the numbers in the caucus has risen, we now have 56 members of the Black caucus now in Congress. The number of women have risen, and in every election, a Black woman has run, and she has not won. We are still a minority in Congress. And so I told them that it's time for our caucus to evaluate what message they're sending. you have to be, I firmly believe you have to be qualified. But if you have unintentional bias or just bias, period, where you don't value the intelligence or the ability of Black women, you will never have a Black woman in a position of leadership. Now, Nancy Pelosi has stepped around that, and in positions that she can personally appoint, she has done a good job of appointing Black women to different leadership positions. But when it comes to the vote of the caucus, 44 years.
That is just astounding. So thank you for that, Congresswoman. Last question I have for you. Then we're going to go to Dr. Terry and Ty for the first two questions. So just so everybody can be prepared. When we talk about addressing America's long-standing racial disparities, many analysts turn to economic solutions, seeking to improve the well-being of Black people and people of color through financial means. But racism in America is also a moral issue, very clear. How can we address this through our political system beyond just fixing some of the structural economic issues?
Well, clearly, I want to go straight to criminal justice reform. How is it that African Americans are, 20% of the population in America? And that may not be the number, but I'm throwing that out there. But they're like 60% of those incarcerated. So for those listening, those are not exact numbers. I'm just giving you a picture. When people go in front of a judge, and I have to include my Black judges too, are African Americans penalized at a higher, longer sentence than other races? And that has nothing to do with economic development. That has to do with a system that I feel is broken. So to give you an example, I was a mayor of a city, and the police department reported to me. So here we are with a police department that was predominantly white and a predominantly Black community. But I mandated that respect of the people, as to give you an example, pull over you such and such, get the so-and-so out the car, versus, excuse me, ma'am, excuse me, sir, I'm going to need you to get out of the car. And if asked, why are you pulling me over? You will give an answer to that. Not what you see is not, don't ask me any questions, just get your so-and-so out of the car. Just that disrespect of a person, whether you want to say it's economic or whether you want to say it's racial, it's unacceptable, and it's so prevalent in the Black community. And you add that to a culture that a lot of people miss something in the George Floyd situation. The officers that was there that day were being trained. They were literally being trained. Can you just imagine if all of this didn't transpire from George Floyd passing away? They were being trained. Put your knee on the neck. When they cry for help, don't help them. That it's okay. Because guess what? I'm new. I'm a new police officer, and this is what I was trained to do. This is how you police. But those officers who were witnessing all of this happening were in training. And so it's about a culture, education. The data shows that when little Black boys act up in a classroom, they are expelled at a very, very high rate. Is it the perception that if you're a little Black boy, anytime you're disobedient, you are a threat and a danger to the class, so you're expelled? You know, they say don't pass judgment. but you have to ask the question. That has nothing to do with social economics. That is inherent behavior that is happening today, that children are being exposed to, that day to day, that a black man driving through a city is stopped. The term is driving while black. I'm just going to pull him over. Give me your license. Shut the F up. And then you are expected to be this, docile, we teach our boys. This is no lie. We teach our boys because you're going to be pulled over if you're a young black male in America. Put your hands on the steering wheel. Don't do eye contact. Just answer the questions. Ask permission to go into your wallet. If he says, give me your license, do not just reach for it. Ask permission. And, call home as soon as you can, And do white boys get that same conversation? I've never heard a white parent saying they told their sons, gave them the talk. And I don't care how wealthy you are. There are very wealthy black men that go through the same scenario.
Congresswoman, I'm going to turn it over to the audience. We have a friend of the show, Dr. Terry Gibbons, who's a political science professor at Equitable University, and then we'll go to Ty. Dr. Terry?
Thanks so much, Justin. And I have so many topics I'd love to cover with you, but I'm going to stick with healthcare. And I have to say, I have given my boys the talk, and it's such a frustrating situation. But I want to talk about particularly the healthcare issues for women that we've seen in terms of maternal and fetal health. I mean, can't we go after the Republicans and say, hey, you guys are the ones who are saying you're pro-life, and yet we have this horrific situation where black women have such poor maternal and fetal health outcomes. So I don't know if there's anything happening right now with that in Congress, but I'm curious what your thoughts are on it. Thank you for being here.
Thank you so much for your question. So sitting on the women's committee for the caucus, what we have really pushed for is raising awareness for the number of women who die giving birth in America. It is embarrassing. It's unacceptable. Women die more from childbirth in some underdeveloped countries. We are the highest of any developed nation. We know that black women die disproportionately more than white women. And when you start talking about healthcare, because we have really tried so hard to peel back this onion, why is this happening? When you're poor and the doctor says come every 6 weeks, then it's every month, and then it's every week. To get your prenatal care, if I'm poor, I'm depending on public transportation, I don't have child care, I'm not doing that. The women just are not getting that prenatal care that is so important. I'm proud to say that I passed the Doula Act for veterans, women, military. Doulas are becoming more and more attractive because they're checking on the mother constantly. The other thing is that, and you've heard women at all social economic levels who will tell you something's not right. And they go to the doctor, say, I'm not feeling, oh, you're fine. If you're black, oh, don't worry about it, you're just pregnant. But if you're white, oh, let's look into that. And the doctors will tell you, I don't know why I do that. It's confronting a bias that maybe isn't deliberate, but I tell you the stories that I've heard has just been heartbreaking of fathers and husbands who say their daughter kept complaining and was going to the doctor, and they just sent her home and said, you're okay. But we had a healthcare crisis when it comes to maternal health. I can tell you I'm a little encouraged because the healthcare industry has stepped up and said, this isn't right. It's something we're doing wrong. And I can tell you we have some partners now who are actually looking at the issue of maternal mortality and setting goals in America to reduce the number of women who are dying in childbirth.
Thank you, Dr. Terry. We will go to Ty, and then we will go to Greg Sittel. Ty, I hope I'm saying.
Hi, Justin. It's Taye, actually, but thank you for checking. I appreciate that. And thank you, Congresswoman, for being here. My question for you is, there are many of us who identify, like myself, I identify as a black woman, who feel as though we are wasting our vote, voting for Democrats particularly, and that we keep being promised certain things, that those things don't keep coming to fruition for us. And so I'm wondering, what is the Democratic caucus doing to substantively make real change for black Americans that will make us want to go back to the polls and vote for Democrats?
I say a lot, we Democrats must really suck at messaging. So I'll give you an example. Who passed the George Floyd Justice and Police Act? Democrats, without any Republican votes. They won't pass it in the Senate. Who passed the John Lewis Voting Rights Act? The Democrats did. Who is voting now to uplift Black and minority women by raising the wages and those who care for our elders and our children? We're doing that. Who during the pandemic voted in the American Rescue Plan to send money? And I had one of my family members, he said, I got my hit. His hit was the stimulus check. He said, we got another hit coming. How many people cashed that stimulus check? That was from the Democrats without support of the Republicans. So why is even that perception that we are a long way from perfect? But everything that has happened in this country that has benefited Black people in America, I would say 98% of it has come strictly from the Democrats. And even this issue of maternal mortality, we're trying to get them to pass it in the Senate, the Republican Senate. When we talk about violence against women, all these things, rights for our LGBTQ community, we fight for that, fighting for feeding of the poor children, WIC, housing, where you see all around this country gentrification and Black people are losing the home ownership in America. Who's fighting and funding through the Department of HUD to re-energize that? So I'm disappointed that we're doing such a poor job in our messaging, but if you sat back and waited for the Republicans to pass anything for the Black community, you're going to be a long wait because they're not doing it.
Thank you for that question, Taye, and beautiful name. So now I will always say it right. We will go to Greg Sittel, and then a Michigan man himself, Eric. Greg.
Congresswoman, thank you very much for joining us. You've been a strong and I think constructive voice for police reform, and my question pertains to that. A few hours ago, the former New Bedford Police Union treasurer pled guilty to stealing funds and will spend, I believe, 12 to 18 months in prison. And just last week, the FBI raided the offices of Ed Mullins, who's the leader of the Sergeants Benevolent Association, one of the major police unions in New York City. And many people believe that the corruption in police unions goes much wider and deeper than that, and it's just the tip of the iceberg. These are the same police unions that protect the bad cops by making sure, pushing requirements in contracts that make it very difficult, if not impossible, for police leaders to discipline bad cops and for the public to know who those bad cops are. But I haven't really heard much from the Congressional Black Caucus, for instance, or other other civil rights groups, specifically about police unions and getting them under control. So my question is, why do you think that is? And or maybe I'm being off base, and there's more going on to get police unions under control than I'm aware.
Well, thank you for your question. I have to say that I haven't heard a lot of discussion about police unions. I've heard a lot of discussion and have been very vocal myself on police behavior when it comes to the mistreatment of our citizens in the United States, and particularly our African American minority community. So, in America, I'm just going to give you this. It's not to discount anything, but doctors who take an oath of to do no harm, who hurt people deliberately, they're sued. A lot of things happen. And it is sad because I'm a very strong union girl. It's very sad when I see corruption within the union, because for many of the rights and freedoms that we have, it came from organizing of unions and labor groups. So I'm disappointed to hear that. Oftentimes people ask me about that defund the police message that some people give. I don't buy into that. I was the mayor of a city, and I know that if there's a domestic violence situation, there's a 911 call, and my expectation is that a trained professional and compassionate police officer will show up to protect. And they take an oath of office as well to serve, honor, and protect. And so in America, sometimes people fail us. It's sad. Some of the frustration things that keep me awake at night. But do we need labor and union organizations who look out for their membership? I support that. I remind people the ability to go to work without being killed or harmed came from unions who organized and said we had to have a safe work environment. To have equal pay for women and men came out of the union movement. To have vacation time and medical leave, all those things were negotiated through unions before they became laws. So it's unacceptable. However, that old saying, don't throw the baby out with the dishwater, with the bath water, I guess it is. Don't throw the baby out with the bath water. So we got a lot of work to do. We have to oversight and keeping our eyes on what's going and moving. It just keeps increasing, and I can tell you that I'm never lost for more work to do.
Thank you for that question and answer. We will go to Eric and then Donna. Just a couple more.
Thank you, Congresswoman Lawrence, my friend. It's great seeing you here on Clubhouse tonight. I wanted to, and I'm always conflicted on asking because there's so much going on, but with the Build Back Better plan and the infrastructure plan. When are we going to, from the Democratic side, increase the number or improve the communications on the impacts both on small businesses as well as on the family unit so that it can be more clearly demonstrated that families are getting direct relief and that small businesses are going to be hired to implement these projects that will come through both programs. Thank you. And
Thank you. And Eric, I recognize you. Hello, how are you? Haven't seen you since COVID. I hope you and your family are doing well.
yes, we are. I hope you're
Eric,
doing well too.
thank you. Like I said to the previous person on the call, is that it's unfortunate that we don't do a better job at messaging. I feel that we're constantly saying that, but one of the benefits that I did mention earlier of Build Back Better is that it will definitely have an impact on families and businesses because if we pass the transportation bill, the number of jobs and infrastructure, I mean the infrastructure bill, the number of jobs, the number of contracts that will be available and built into the infrastructure bill is the requirement to reach out to small businesses, local businesses, and minority owned businesses. So one thing Jim Clyburn said that was just so eloquent, he said, the last time we deliberately rebuilt America was the New Deal. And when the New Deal was done, all of America didn't benefit from that, and all of America didn't rise. And he said it, and I was in a room with he and the president. He said, Mr. President, we have to make sure that when we build back better, everyone, including minorities and women, we all are going to benefit from it.
Thank you for that, Congresswoman. Before we go to our last questioner here, which is going to be Donna, I did just want to say we've had, a bunch, 20 maybe members of Congress on, so I've dealt with a lot of staff. I used to work in the Hill, then for the governor of Puerto Rico. I just wanted to praise Cody, your comm staffer here. He's been a pleasure to work with and make things very, very easy on us. So I just wanted to get that out there. But we will go to Donna next for the
Thanks, Justin, and thanks, Congresswoman Lawrence. I enjoyed hearing about your work to help close the gaps both in vaccine hesitancy, also the gender wage gap. My question is around childcare, and you talked about the high cost of childcare for women and couples, and that you're working to try and lower the cost in Michigan to 7% of a parent's income or a couple's income, or either way. I think that would be great for so many families in Michigan, but also throughout the country. What type of conversations are you having, or are you having conversations about this with congressmen and women from other parts?
So this will be a federal bill, so it would be across the country because it's being in Congress, when we pass a bill, it's across the country. So this will include everyone. I do want to take an opportunity to just take the personal privilege to say I'm so lucky to have Cody on my team. He's amazing. He's not only talented and gifted, but like you said, he's so he makes working together just a smooth transaction. He is really amazing. So when we talk about 7% of the income of a family as being the most that someone will pay for childcare, that's across the country. So I'm excited. When we vote on this bill, this will be enacted for the United States of America.
Thank you for that, Congresswoman. So we're going to ask you your last thoughts here. Let's see. What do you want to leave the audience with? It could be about anything we spoke about. It could be about democracy. It could be about whatever you want. It could be optimistic, pessimistic, or somewhere.
Well, I'm going to leave the audience with something that I say a lot, and I feel that it's important to repeat this. I love America. I love America even though she didn't love me back. She didn't love me because I was black. She didn't love me because I was a woman. We went through a whole civil rights movement. Women had to fight for their rights. But the democracy that we have in this country allowed the voice of the people to resonate to a level to change for the better. We've got some things that are not working right now in America, but please don't check out. Check in, because this is our country. And for all of the history that you can see with rights for children to be educated, workers' rights, when we look at rights for women, rights for minorities, just think about housing in America. There was a time, if you were a certain color or ethnicity, you were banned in the deed not to be able to buy that home. So while we have a lot wrong, and COVID has just really been exhausting, and I will say the last 4 years of attacks on our democracy, we are still a great country, but we're only great when we all check in and fight for what we know is right for each other, for our community, and for our country.
That is all we have for you today. Again, huge thanks to Congresswoman Lawrence for coming out, to our audience for their questions, and to you for being here. If you like or dislike what you hear, if you want to find out how to join us live almost every day of the week, maybe ask one of our upcoming guests a question, or hear past episodes, please visit our website, pm101.club or pm101.live. They both work and will get you to the same place where you can find all that and more. This has been Politics and Media 101. I'm Jeff Browning. On behalf of Justin Higgins, our co-founder, and our team, thank you very much for being here. We hope to see you and hear from you soon.